Tonight's guest is a truly very unique person. I'd like to introduce Miss Stacy Kalisz Johnson. Stacy is a health and wellness coach as well as a business mentor. Welcome, Stacy.
Hi.
I understand that you graduated from George Washington University as well as the Rochester Institute of Technology, where you also became a Zeta Tau Alpha sister.
Correct.
She has significant background in engineering, but her most recent phase of her career, she decided to become a wellness coach and has been coaching for over 11 years. How did you get interested in becoming a wellness coach?
I've been a volunteer with the American Heart Association since 2008, and I would often get pulled into public speaking engagements similar to this one, talking about heart health. And then people would approach me after and say, okay, I liked what you said. I need to make changes, but I don't know how. And my husband and I would create, like, okay, this person is focused on this person. And so we were creating all these like custom things, and it really wasn't scalable to help more people. And it's obviously epidemic, if not a pandemic style problem, heart disease in our nation specifically, but globally as well. And so that's when it started. We needed something more scalable so that I could help more people. Yeah,
Right.
so that's how
And
it started.
that's awesome. And you also mentor people's health by Catalyst by enabling individuals to lead healthier and more fulfilling lives by transformational coaching as well as fitness journey, like tracking it and how they improve going throughout. You also do a face-to-face virtual accountable groups, and they are time-based process to complete nutrition and structural exercise programs. You have also leveraged social media to facilitate positive customer experiences. Is there
Yeah, so
anything
we
else that you'd like to
basically,
add?
yeah, so I have an infrastructure where now that it's scalable, it doesn't matter where you are. So I'm in Arizona, you're in the East Coast, right? Doesn't matter. It can work for people anywhere. And we use an app, we use a Facebook group, sometimes text groups. Like I just meet people where they need to for communication to create the right accountability infrastructure. And then I have streaming services that have curricula for exercise as well as nutrition. So just all of the tools that you would need to make heart health a part of your daily routine are available. And yeah, that's
And
how it
so
looks.
that leads us to the next part about this interview, and is talking a little bit more in depth about heart disease. As now February is Heart Disease Month, and I was just curious to see how we can make better lifestyle choices so we don't get a heart attack. And I understand that heart disease is the #1 killer of women, causing 1 in 3 deaths each year.
Yes, it's number one killer of both men and women, killing more people than all forms of cancer combined. And we know from our mutual Zeta Tau Alpha sisterhood, right? We do a lot for breast cancer causes too, but heart disease is actually a bigger threat to men and women's health. And many women specifically don't know that.
Right. And in 2004, the American Heart Association started Go Red for Women because, as you mentioned, almost 500,000 American women were dying from each year from the heart disease and didn't know that heart disease was the #1 killer or health threat. Can you share with us a little bit more specific information about this program?
Yeah, and actually I have the logo. So when you see this little red dress, the idea is that you think of heart disease and the Go Red for Women movement. And if you contrast it, when you see a pink ribbon, especially as a Zeta Tau Alpha, you know exactly what it means, right? Think
Right.
pink, breast cancer awareness. But many people, when they see this little red dress symbol that I have on, they don't know what it is. And that's kind of the genesis of what happened is in 2004, there was some sort of survey or data that became available that indicated women specifically really did not understand how much of a threat heart disease was. And so they founded the Go Red for Women initiative or movement. And if you go to, and we can put this in the chat later also, but if you go to goredforwomen.org, that's a website that has a way for you to, what they say, align to the movement, which basically means register. And then you get things like healthy recipes or tips and tricks, sometimes information about legislation that might be impacting heart health, but it's just all the ways to get educated. And, from a technical standpoint, many of the studies that were done for figuring out how to mitigate heart disease, they're done on men, right? So even that needs to be addressed. Like, what about the women and how they manifest symptoms? All of these things. So the Go Red for Women movement, it also targets the women because 70, I think it's 70 or 75% of meal choices in a home where there's a family present are still being dictated by the mom, by the women. And so we need to make sure that they know how to prepare heart healthy meals for their kids and family. Otherwise, we're perpetuating this problem to the next generation as well.
Right. And you mentioned about symptoms briefly. What are some of the different symptoms in men versus women when it comes to a heart attack warning? And they might be completely different. Is that correct in stating that?
Yeah, so it's kind of like you see on TV, right, where the men are like, grabbing their chest or maybe their left arm, but women can sometimes have that as well, but they might also have just like low back pain or even jaw pain or just feel off. It could even manifest almost flu-like. So then you say, well, then jeepers, how do I know that I'm having a heart attack? So you have to know yourself, right? And you need to know your numbers, right? You need to know what your blood pressure should be at. You need to know your cholesterol. So we have pulse ox, the little pulse where it measures your heart rate and
Yeah.
oxygen. We have one in every car. We have blood pressure cuff here at the house. So we're always getting data. So I highly recommend that. But also just know that if you just don't feel right, you can get eyes from a doctor. And if it's eminent where you're like, wow, something is really not right. I heard this in a CPR class. The instructor was an ambulance driver, and he's like, just remember, if you don't feel right, call 911. When they come, you don't have to pay unless you take a ride. Because I
Right.
think sometimes we worry about the cost of medical help, and so we don't always take proactive action because of that. And so if it's imminent, you need to get help immediately. So yeah, there's actually a kind of a spoofy commercial like video called Just a Little Heart Attack, where Elizabeth Banks portrays a busy working mom who's just getting her household ready, but she starts to sweat, she starts to have chest pain, she starts to feel kind of ugh, and her kid is like, Mom, I think you're having a heart attack. You need to call 911. And they point her to one of the
Right.
websites. So it is common for women to be like, I'm just not feeling good. I'm a busy person. And so that must be why. Um, but that is not the case. You need to know your body. Yeah.
And so we are more individuals. How can we be more prepared when a heart attack does happen? Like, what are some of the uncontrollable risk factors for heart disease, or some of the major controllable factors that can happen during this time?
Sure. So the things we cannot control are age, right? We're all getting older. Doesn't matter where you're starting. You're still older today than you were yesterday. Heredity. So in my case, and kind of how I got aligned to this movement, when my oldest son was about 2, I looked at his feet and I was like, wow, they look just like my dad's. And I froze because I thought, wait a minute, if the outside looks like my dad, the inside probably does too. And my dad had had heart attacks before I was even born, before the age of 30. His brother died of sudden cardiac arrest at 39, and my grandfather at 49. So I needed to get educated because I can't control the heredity. So age and then her heredity. And then the third thing you can't control is your kind of family lineage. So for example, women of color have even a higher risk factor than people who are not of color. So those are the uncontrollables. So then you asked, well, what do we do to mitigate our risks? Well, the good news is 80% of the risk factors are mitigated by lifestyle changes and choices. So knowing your cholesterol, knowing your blood pressure, knowing your BMI, and then managing that to be in appropriate levels, avoiding disease like obesity and diabetes, but then also, adding in sleep, drinking your water, adding in good diet, nutrition, vegetables and fruits, and high protein diet and exercise, right? These are the things we know these things, but do we focus on them enough? And then the data is the feedback loop, right? So like if I'm not doing these things, then I'm putting myself at risk, and that's kind of what we need to manage. And then you asked about like what about when I'm actively having a heart attack, right? So you need to get eyes right away from a medical professional. Same thing with stroke. Time is of the essence. But one of the things that happens to me with my health coaching is people will call, will talk like, oh, I gotta get started, but something holds them back, whether it's time or money, I don't know, something holds them back. And then the unfortunate outcome is then they call me like, okay, so there's been a cardiac event. So between those two times are what we want to pull it forward. If 80% of the risk factors are mitigated by lifestyle changes and choices, start now. And it starts small. Drink your water. Just start with that, right? Look
Right.
at your sleep. They say that if you, there was an article published in 2015 that said if you dip below 6 hours of sleep, it's like the equivalent of smoking a pack of cigarettes on your body.
Oh my
What?
gosh. Yeah.
What? Smoking a pack of cigarettes? Everybody knows that's bad for your heart health,
Right.
right?
Right.
So just starting small, start with water, start with adding sleep, start with one vegetable, right? Just keep adding and then you'll get there. Yeah.
And are there any upcoming events that you can share with us so that we can volunteer and to help raise awareness for the American heart disease situation, either locally in my state or in any other state across the country?
Yeah, so the if you go to heart.org in any city or any wherever you are physically in your geography, there's lots of things that are available. They're always raising money so that medical advancements can be made. There's also events that are small and local, and then there's kind of like the flagship event. So the Heart Walk, I almost said Phoenix Heart Walk because that's what I always call it, being in Phoenix, Arizona. But there are heart walks throughout. There's one in New Haven, there's one in Fairfield, there's one in Hartford, because you said Connecticut.
Yes, that's right.
So if you go to heart.org, you can kind of navigate. But all I did to find the landing page for the heart walks was go to heart.org and just follow through. And I think I've also played around with just Googling like heart walk near me, so that we can post that in the comments. But yes, there are activities. But if you go to heart.org, you can find your local office and you can engage that way. I do a lot of volunteer spokesperson activities. I've done some really cool stuff through that, but we often also go to and or participate in the Heart Walk. It's usually, I don't know if it's like this in every city, but usually it's free to register. And then there's an optional fundraising component, and there's just as much of an awareness piece as there is a fundraising. It's a really fun activity to do with your family to promote heart health, or with your friends to promote heart health in your local community.
Thank you so much, Stacy, for taking the time out today to speak with us and educating us on heart disease. This is a disease that affects my family deeply, including my own family. My father had to have heart surgery a couple of years ago, but is doing very well now. And I am so grateful to now have more in-depth facts about heart disease so I can share this with the people I care about most. Thank you so much for visiting with us tonight.
Right. Thank you.